Hello and welcome. Today we're diving into biliary dyskinesia, a condition that affects the gallbladder and can lead to some pretty uncomfortable symptoms. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. So, let's get started on understanding this complex disorder. Biliary dyskinesia essentially boils down to a gallbladder that isn't squeezing properly. The exact cause is often a mystery, but several factors are thought to play a role. These include problems with the gallbladder's muscular contractions, dysfunction of the sphincter of Oddi which regulates bile flow, hormonal imbalances, or even inflammation within the gallbladder. In some instances, small gallstones or sludge might be present, even if they aren't detected by standard imaging. It's often multifactorial and difficult to pinpoint a single cause. Now let's talk about what happens when things go wrong. The gallbladder's primary job is to store and concentrate bile, a fluid produced by the liver that aids in digestion, particularly the breakdown of fats. When you eat, the gallbladder is supposed to contract and release bile into the small intestine. In biliary dyskinesia, the gallbladder either doesn't contract strongly enough or doesn't coordinate its contractions properly. This can lead to a buildup of bile, increased pressure, and ultimately, pain. The sphincter of Oddi, which is responsible for letting bile into the small intestines, can also malfunction, adding to the digestive distress. Biliary dyskinesia isn't a super common condition, but it's not rare either. It tends to affect women more often than men, and it's most commonly diagnosed in people between the ages of 30 and 60. It's important to consider this condition when evaluating patients with chronic abdominal pain, particularly if other common causes have been ruled out. The hallmark symptom of biliary dyskinesia is biliary-type pain. This is usually located in the upper right abdomen or epigastric region at the upper central abdomen, and it can be described as a dull ache, a sharp stabbing, or a cramping sensation. The pain often comes and goes, lasting from 30 minutes to several hours. It can be triggered by eating fatty meals, although sometimes there is no clear trigger. Other symptoms may include nausea, vomiting, indigestion, and in some cases, diarrhea. Diagnosing biliary dyskinesia can be a bit tricky because there's no single definitive test. The most important diagnostic tool is a Hades scan, also known as a coloscintigraphy scan. This involves injecting a radioactive tracer into your bloodstream that is then taken up by the liver and excreted into the bile. The Hades scan measures the gallbladder's ejection fraction, which is the percentage of bile it releases during contraction. A low ejection fraction, typically below 35–40%, suggests biliary dyskinesia. Other tests, such as ultrasound and blood tests, are usually performed to rule out other conditions like gallstones or liver disease. While there aren't distinct types of biliary dyskinesia in the traditional sense, it's helpful to consider it as either primarily related to gallbladder dysfunction or primarily related to sphincter of Oddi dysfunction. In some cases, both contribute to the symptoms. Understanding the predominant factor helps guide treatment decisions. The primary treatment for biliary dyskinesia is often surgical removal of the gallbladder, a procedure called a cholecystectomy. This is usually done laparoscopically, meaning through small incisions, and recovery is typically quick. For individuals who are not good candidates for surgery, or who want to try other options first, medications to relax the sphincter of Oddi or manage pain may be used. Dietary modifications, such as avoiding high-fat meals, can also help manage symptoms. Unfortunately, there aren't any specific proven methods to prevent biliary dyskinesia. However, maintaining a healthy weight, eating a balanced diet, and avoiding rapid weight loss may help reduce the risk of gallbladder problems in general. It's also important to seek medical attention promptly if you experience persistent abdominal pain. The prognosis for biliary dyskinesia after gallbladder removal is generally good. Most people experience significant improvement or complete resolution of their symptoms. However, some individuals may continue to have digestive issues, such as diarrhea or bloating, after surgery. Research is ongoing to better understand the underlying causes of biliary dyskinesia and to develop more targeted and effective treatments. For instance, some studies are exploring the role of gut microbiota in gallbladder function and the potential benefits of probiotic supplementation. Continued research is essential to improve the diagnosis and management of this challenging condition.